Hello, welcome to ANA community. Previously, we have discussed the context of Bahya Srotas. Initially, we have discussed with Asya or mouth, followed by the description of Netra. Later, the description of Nasa has happened, and later we have discussed the Karana. In today's video, we are going to discuss Guda or anus, its significance as Bahya Srotas. So, when you think about the Guda or anus, so this is considered to be the one which is responsible for the expulsion of the metabolites, that is undigested food residue from the alimentary canal, which is present in Antaradhi. What we can say, the part which is present between the limbs and head and neck. So that is what we can say, that is the Antaradhi or the uh, Antaradhi part of the body. Actually, it is being mentioned the functions of the Guda is nothing but the Vega Kale Karma Karanam and Avega Kale Dharanam. That means the main function of Apanavata will be mainly followed by this particular Guda. In this particular occasion, it is the Purisha that will be stored when the person is not getting any kind of the Vega. Whereas when the person is getting the urge of defecation, that is expulsion of these undigested food residue will happen. So when you think about the functions of Purisha, what we can say, one of the mala, that is the fecal matter. So that is being mentioned that avashtambaha. Avashtamba in the sense that is being said that by the commentators, that is Dehadharana Shakti. That means the sustaining the uh, human body is the main function of this Purisha. So what is the rationale behind Deha Dharana Shakti? It is being mentioned that the alimentary canal is the source of all the nutrients, macronutrients and micronutrients, including the electrolytes. The absorption of these electrolytes that happens from the large intestine. So this sodium, potassium, etc., they are going to get absorbed from the large intestine, which are essential for all the activities of skeletal muscle, all the activities of smooth muscle, all the activities of cardiac muscle, and all neuronal activities such as the nerve conduction, etc., that will be mainly followed by this particular electrolytes, sodium, potassium, and calcium. So this is what we can say, the avashtambaha. If the person is having the excess passage of the liquid stools, there will be the deficiency of these electrolytes may happen and the person will not have the sustaining the human body will not be there. Apanavata is considered to be helpful in the proper functioning of a Guda itself. Now, regarding the functional anatomy of the large intestine, it is being mentioned that the the functions of Guda, they considered to be storage. When you think about the functions of large intestine, that is having the two types of the functions. One that is the absorbing colon, and the second one that is storage colon. When the food residue enters from ileocecal junction into the cecum, it will be around 1200 ml. Whereas when this particular fecal matter enters into the rectum, the amount will be reduced to 100 ml. Rest of them that is going to get absorbed from the proximal half of what we say that the absorbing colon, what we can say. Whereas the descending colon onwards as such, we are going to see the storage column, which will be storing the fecal matter in the large intestine, so that when the person is getting the urge, that is going to get eliminated. As far as Nidana of the Guda Vikara are basically suppression of Purisha, Mutra, and Adhovata. This is being mentioned in the Roga Nidana. When the person is having the suppression of these urges, what are the different clinical manifestations are possible? So wherein there will be the initially Apanavata Dishti, which will be leading to the reverse movement of the Apanavata, which in turn leads to the Samanavata dysfunction, which leads to the Ahara to have avipaka, that means proper digestion of the ingested food will not happen, which in turn results in the Viloma Pravritti of Samanavata, thereby the Pranavata dysfunction may possible, wherein the person may have the vomiting or nausea, etc. etc. This is the outcome of what you say, that is simple suppression of the Purisha, Mutra or Adhovata. Further, improper administration of Basti, maybe in terms of the administration, if the proper the measures are not being taken. For example, if the Basti preparation is not being done, and during the administration the proper insertion is not being done, proper oleation is not being done, then the person may have the damage or injury to the Guda, thereby the person may have the dysfunction, such as what you say, that the fissure in ano, etc., that may be developed. As far as the surgical aspect, damage to the anal sphincter, specifically during the surgery of hemorrhoids, during the severe constipation, there will be the surgeons, they are going to do is the impacted fecal matter they are going to remove forcefully, which in turn damage the anal sphincter, thereby the person may have the permanent damage to the anal sphincter, wherein the aveka kale dharanam will not be possible. Tikshna ahara and snigdha ahara, which in turn results in the increase of pitta, or what we can say, increased peristaltic movements or increased inflammatory reaction that may happen in the small intestine, large intestine, thereby the person will be having the excessive movement. Sexual perversions, specifically anal intercourse, which may damage the anal sphincter. Vihara, such as shoka, vyayama, vyavaya, shitavata sevana, atapa sevana, exposure to shitakala, etc., that will be resulting in the constriction of what you say, that the anal sphincter, wherein the person may have the poor peristaltic movements, the person may have constipated bowel habits may be present. As far as significance of this particular Guda is concerned, as we have discussed earlier, Nidana, that may lead to the Guda dysfunction, plus exposure to contaminated water or external factors. If proper hygiene, personal hygiene is not being maintained, there may be a possibility of a infection that may result. There is already large intestine is considered to be the storage area for bacteria. Pathogenic bacteria may also get grow, thereby the person may have the anal diseases or anorectal diseases may be possible. Improperly administered basti, that is improperly prepared basti, or if the properly basti administration is not being done, or improper snehana or swedana to the local area, if that is not being done, then the person may have the Guda Vikara. And here, the source of entry will be there through the anus, which in turn damage the anal mucosa or rectal mucosa, and there may be a possibility of inflammation of the colonal mucosa also. Here, the stasis of pathogen may take place in the colon, which in turn results in the inflammation of the colon. Therein, intracellular compartment involvement can be predicted. Why intracellular in compartment involvement? Because here there is no possibility of the Agni dysfunction initially will be present. Hence, there will be intracellular compartment may be getting afflicted. The take-home messages from today's discussion are: one of the important Bahya Srotas which gets afflicted in case of abnormal Ahara and Vihara, such as Tikshna Ahara, etc. Vihara in the sense, if the person is doing the long travel, that too in a bus or so, wherein the person is not in a position to have the attending this particular natural call, then there may be a possibility of a constipation may be possible. Thereby the person may have the dysfunction related to rectum as such may happen. Improper administration of basti may lead to Mahasrotas affliction. The clinical presentation may vary from simple pain during defecation, such as the fissure in ano, etc., to life-threatening bleeding per rectum. For example, the carcinoma of the rectum, etc., or colonitis, etc. This may happen because of the variation of the number of exposures of pathogen or virulence of the pathogen, etc. Hence, you need to identify the cause of the disease and eliminate the cause is the first line of treatment as far as Ayurveda is concerned. Sushruta says, Sankshepatah Kriya Yogo Nidana Parivarjanam. The first chapter of Uttara Tantra of Sushruta Samhita discusses about this particular shloka. Dear community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners or true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.